This is John Lohr. I'm here today at Woodbury Spine with Dr. Evan O'Brien. And Doctor, can you share with us another spinal condition that you can treat through non-surgical and surgical ways?
Sure. We just briefly talked a little bit about lumbar instability or spinal instability, depending on what part of the spine is involved. But that happens. Our spines are designed to be mobile and to move, and we have discs, which are cushions in between the levels where the motion occurs through those discs. Sometimes the motion becomes abnormal and loose. You'll get what we call a translational motion or a sliding motion of the spine. That's abnormal, and that motion can create what we call mechanical back pain. It can also create nerve pinching by the fact that the motion can create pinching of the nerves. The treatment for that, if patients don't respond to conservative treatment such as exercise and muscle strengthening, is to stabilize that segment of the spine that's loose. And that's what's commonly called a fusion surgery, a spinal fusion. And we do that for different areas of instability, but the most common areas are in the lumbar spine, the low back area. And frequently we'll have a patient who has spondylolisthesis, a slipping of the spine at one level. Sometimes they'll also have nerve compression. We'll go in, we'll create more room, and then we'll stabilize the spine with screws and rods called pedicle screws. Sometimes these surgeries can be done percutaneously, that is minimally invasively. We do through very small incisions. We can put in, using x-ray machines, we can target the pedicles, put wires in, and then put screws over the wires. Other times we need to also remove some bone, and we do an open technique where we remove bone, create more room for the nerves, and then stabilize the loose segment of the spine with the pedicle screw hardware. We do the surgery sometimes from the back of the spine, but sometimes we also need to go into the front of the spine where we can remove the discs and put in spacers to create more stability and to help ensure the proper spinal alignment. It's very important that when we're finished that we've either maintained or improved the spinal alignment so that the patient can function well with less back pain.
Thank you for sharing this important information with us today.
Sure.